This video emphasizes materials that we did not discuss in class but I believe are important for exam purposes. Please review the Tong article dealing with professional-patient relationship, focusing particularly on pages 48 through 56. Review the ANA fact sheet on navigating the world of social media, and the Hannah and Suplee article on professional boundaries. Tong discusses behaviors that are seen as nurse responsibilities and patient rights, and confidentiality is the expectation that information given by the patient will be kept confidential and seen only by those with a need to know in order to provide safe, effective care. This confidentiality is a basis for trust, which is the basis for a therapeutic professional relationship. Guidelines for confidentiality and privacy are specified in legislation known as HIPAA. This law sets very detailed expectations for how patient information can be made available to others to provide care. In your nursing research class in J1, you will complete an online HIPAA module that will affirm as a nursing student that you will conduct yourself in an ethical manner in terms of patient confidentiality. HIPAA was enacted to ensure continuity of care and maintenance of health insurance when people moved or changed jobs. This was not an assurance before this legislation was passed in 1996. But HIPAA also developed specific guidelines for disclosure of protected health information, PHI, and clarified what personal health information was protected and could or could not be shared with third-party individuals. I've included a website providing a succinct discussion of HIPAA and PHI. HIPAA also clarified when confidentiality could and should be violated or breached, and when the provider needed to inform a person of authority about a confidential situation. We will talk more about situations in which confidentiality can be appropriately and ethically breached. Truthfulness and veracity is another nurse responsibility and patient expectation. This requires honesty in all aspects of communication. Inherent in this is the idea of full disclosure, that is telling everything about a condition. The dilemma involves how much to tell a patient about a situation, especially a terminal situation. The extent of full disclosure has cultural implications. Individuals in some cultures do not want to know about serious illnesses or impending or probable death, and this is why this is such an ethical dilemma. The key is that whatever the nurse or physician communicates must be accurate and truthful as known by the provider at that point in time. Informed consent is the legal outcome of HIPAA, and now two aspects of informed consent involve a patient's willing acceptance of a medical procedure and is based on what is considered adequate disclosure. Adequate disclosure for informed consent requires 6 criteria, and all 6 must be included for the consent to be considered adequate disclosure. Your responsibility is to ensure that the patient is aware of these 6 pieces of information and understands the implication of the information. An informed consent includes the actual diagnosis or prognosis as known at the time, the nature of the proposed treatment, the identified risk and hazard from the procedure, the estimated probability of success of the procedure, identification of alternative approaches or treatments, and the anticipated benefits to the patient. As you can imagine, including this information takes time and requires considerable insight and understanding on the part of the patient. This involves the idea of competency. Competency is the cognitive ability of the individual to understand the information, reason and deliberate about a possible course of action, and then communicate the decision to others in an unforced, uncoerced manner. In cases of questionable competency, there are two accepted alternate standards. The customary practice standard involves disclosing information in the depth and breadth customarily or generally given in a particular area or location. This may involve limited identification of alternatives if they do not exist in that area, or different wording of the surgery if terminology is not easily understood. The second alternative standard is known as the reasonable patient standard. This is a more comprehensive approach. Disclosure is made to the extent that a reasonable patient anywhere in the country or another country could consider adequate or necessary to make a good treatment choice. The reasonable patient standard is recommended over the customary practice standard because the customary standard is so very localized and variable. The ideal is the full 6 criteria informed consent, but this is not always possible. Moving into the discussion of ethics in social media, this slide and the next identify specific requirements when navigating the world of social media. One must not transmit or place online any individually identifiable patient information. Never post any picture or information about a person you are dealing with in a professional relationship. You must observe prescribed professional nurse-patient boundaries, and it is critical that you realize that anyone may view your individual postings for years to come. What you have posted previously may come back to you in the future. Certainly from this point onward, be knowledgeable in the ethical aspects of social media and adhere to the guidelines. Other responsibilities are to ensure that you incorporate all available privacy settings, that you totally separate personal and professional information online. That includes email addresses and other social postings by name. It is your expectation to alert appropriate authorities when there is knowledge of any content that could harm a patient's privacy. And in the future, your responsibility will be to participate in developing institutional policies that govern future online conduct. This slide identifies tips to avoid issues with social media. Again, the key is to adhere to professional expectations in online communication as you would in person-to-person situations. Do not share information or photos gained through the nurse-patient relationship. Maintain professional boundaries. It is recommended that one does not initiate or maintain online contacts with patients. This blurs the patient-professional boundaries and can complicate future relationships. Additional tips: do not make disparaging comments about patients, employers, or co-workers, even if they are not identified by name. Above all, do not take photos or videos of patients on personal devices, including cell phones. Promptly report a breach of confidentiality that you're aware of. Many agencies have specific protocol identified for dealing with social media. It is your responsibility as a student and as an employee to adhere to these protocols. The article by Hannah and Sir Plee was written about professional boundaries. It was written by nurses for nurses, so this is directed to you. The key to maintaining appropriate professional boundaries is to recognize the space between your power as a nurse and the client's vulnerability. The web link listed is a particularly helpful document for guidelines in establishing and maintaining professional boundaries. It is important to understand two definitions. Boundary crossing is a decision made by the nurse to deviate from an established and recognized boundary for a specific identified purpose that could possibly be considered therapeutic in certain situations. They use the example of when touching is appropriate and when touching a patient may be inappropriate. So boundary crossing is an issue, but it is not a severe and ethical issue as is boundary violation. A boundary violation is an overt, deliberate crossing of a therapeutic boundary for reasons that are not even arguably therapeutic, and this is a key phrase, could not ever be really justified or argued as potentially therapeutic. Boundary violations are an example of serious misconduct. Confidentiality violations are one example, but the most significant boundary violation is that of sexual misconduct. Sexual misconduct is the most serious boundary violation. You see listed on the slide specific examples of sexual misconduct. This activity is never seen as therapeutic or within the bounds of a professional nurse-patient relationship and constitutes grounds for loss of license. Any sexual conduct in the process of a professional nurse-patient relationship is considered a serious boundary violation. Hannah and Supplee identify those who are at risk for boundary violations. These are considered the most vulnerable patients. Actually, when looking at the list, any of these could include all patients that we deal with on a regular basis. But once identified, the nurse's responsibility is to protect these vulnerable people from future harm or violation. Review the potential legal consequences of boundary violations. These include investigation by the Board of Nursing or perhaps even law enforcement through a criminal investigation. You could be a party to a civil lawsuit. You could lose your RN license or even have criminal charges brought. Boundary issues involve very serious ethical dilemmas. You must become knowledgeable in your professional responsibilities. Know the differences in the guidelines from the ANA, the Texas Board of Nursing. Review the professional boundaries document on the web link from the National Council of State Boards of Nursing. Your responsibility is to follow agency protocols about violation of boundaries, social media, to document the facts, and then to inform the appropriate authorities when identified. You will be dealing with issues of patient confidentiality and privacy. All of this is to ensure patient-centered care in a therapeutic nurse-patient relationship. Please review the Exam 1 study guide for specific questions to consider in reviewing this material in preparation for the Exam 1.